Hi everyone, I'm Dr. Mark LeMay, and I've got a personal story I'd like to share with you because I don't know about you, but I learn from stories, and this is something that happened to me a month ago. I started to develop some sensitivity in my left upper molar here, and it's like I'm thinking, oh, there's something going on. I need to go get this checked out. So I go to my dentist. They take pictures like they always do, and they say, you've got a pretty big cavity on that side. We really need to get that thing taken care of. So I'm like, okay, great, let's do it. So when she's in there, she basically cleaned out. She goes, you have a big one here. I mean, this is like right up against the nerve root. And she said, I don't know if we're going to be able to save this, because when it's this close to the nerve, it could possibly cause infection. The nerve root could die. You have to have a root canal. I'm like, oh, not a root canal. I've had one of those before down here years ago, and it's like, that's not a fun procedure, okay? So I'm like, okay, if we can save this, let's go for it. So she said, okay, so I'm going to clean it out, use some ozone, because that really helps to clean up bacteria and kill bacteria. Fill it in, and then we will see what's going on after this. You can use certain things that that helps to upregulate your immune system, help with healing, all those things. So I think, great, let's do that. So 2 weeks goes by, I'm doing really good, and then the pain starts all over again, except for this is worse. It's up here again, but it's anywhere from a 1 all the way up to a 7. Now, 5 is like when it starts to throb, like with your heartbeat. That's very, very painful. 6 is like, you're like, oh my gosh, I just want to lay down because this is hurting so bad. And 7 is like you start to breathe. You're like, because for some reason you think you can kind of breathe your way through the pain. It's kind of like when women are in labor, it's just like about ready to give birth, but that's how bad the pain was. And I'm like, oh gosh, I got to go back. So go back to the dentist, they take another picture to see what's going on, and the dentist looks at it and goes, everything looks normal. And I'm like, what? I go, I don't feel normal. This is like anywhere from a 1 to a 7, and it's like, this is very painful. She's like, well, let's try some things. I mean, there might be like an irritation of the nerve root. There could be something going on with the bone. I mean, it could be an infection. Let's try homeopathic for this. And this was like on Friday. It was almost 2 weeks ago. It was on Friday, because they got me in as like an emergency before they left for the day. And so she gives me homeopathic and says, if you have anything else you can try to calm things down, go for it, because it's nothing else. There's nothing else going on. So basically what I did is I remember Professor Carrie Bone at one of our seminars talking about you can do a loading dose for an infection. And so I got out the Echinacea Premium. And there's also another great product here by a company called Third Planet. It's called Turmeric Phyto-Rab. It's an excellent product for inflammation. So the normal dose for Echinacea Premium a day is like 2 to 3 tablets. And for the Turmeric Phyto-Rab, it's only 1 to 2 capsules a day. So I did 4 of the turmeric, and I did 6 tablets in an hour for the Echinacea Premium. And so I'm laying on the couch with Michelle, talking to her. I'm laying on my side and taking 1 tablet of the Echinacea Premium. And I'm not kidding, within a half hour, the pain went from a 6-7 down to a 4, which is below 5, which is that throbbing. I'm like, oh, thank you. That was way better right there. But I'm not kidding you. After 1 hour, the pain was down to a 1. A 1. I mean, I got up and I'm like, oh my gosh, that is so much better. I mean, I can actually chew a little bit now, because before, for the last 4 days, I couldn't have anything unless it had to be soft and, or liquid, because it just hurt too much to chew. So I'm thinking to myself, wow, that really worked like that for this day. The next day, what if I do it again? So because I woke up in the morning and it was a 1. So I decided, okay, I'm going to do it again. I'm going to do a loading dose, keep taking 4 of the turmeric a day. And I'm not kidding you. The pain went away. And I'm like, I can bite down on stuff again. It doesn't hurt. This is amazing. Now, I just want to tell you, I'm not a dentist, and I'm not telling you to do this. I mean, definitely go see your dentist first. I mean, you could have a cracked tooth. You could have a bunch of different things going on there. You got to find out what's going on. Me, from talking to my dentist, you know, we knew what was going on. I mean, I talked to her like on Monday morning and said, hey, here's what's going on here. She's like, that's awesome, you know, so keep it up. And so I just did it for 4 days, and I'm not kidding you. There has not been any problems at all with my tooth. And it's way past 10 days now. So I just thought that I would share that story with you because I've never had this happen to me before. And whenever I have, you know, the different stories I hear from patients, you know, and their results with different things that we're doing here, I like to kind of share that with people because that's the best way to find out how things work. And I can definitely tell you that, again, if this was either for a neuritis or was an infection or whatever, boy, I tell you, that echinacea premium and that turmeric phytorev worked beautifully. So I hope you found that helpful. And we'll see you on the next time when I have another good story to share with everyone. Bye for now.